Today we are going to talk about glaucomas. Glaucoma means the normal eye pressure is above the normal limit. The normal limit is 10 to 21 with the average of 16 millimeter mercury. So anything above the normal range is considered as eye pressure is increased in that particular eye of the patient. Now, basically, glaucoma is divided into several types. The first one is the chronic simple glaucoma. Chronic simple glaucoma, the other name for this one is chronic open angle glaucoma. The second type is the angle closure glaucoma. Angle closure glaucoma is basically divided into acute type, subacute type, chronic type, absolute type, and the latent type. Now, the acute type means it comes as a typical angle closure glaucoma. That means there will be pain, there will be tearing, and the redness of the eye. Those are the common symptoms of the angle closure glaucoma. Subacute type is almost like the acute type, but the severity is considered to the acute type, it is less. Now, chronic type of angle closure glaucoma behave like the chronic open angle glaucoma. And there are other types, as we mentioned, absolute and chronic type. Chronic type behave like chronic simple glaucoma. And there are conditions like normal tension glaucoma. Normal tension glaucoma, other name is low tension glaucoma. That means the eye pressure is within the normal range, but other parameters like field defects and the disc changes may be almost similar to the glaucomatous eye. Now, this there's a condition called pseudo-low-tension glaucoma. That means in the past there may be some postpartum hemorrhages in females, and some accidents also can cause some disc changes when we do the evaluation of the disc. Now, how to differentiate the pseudo-low-tension glaucoma and the normal tension glaucoma? So you repeat the fields uh, testing and the disc evaluation after 6 months, and when there is any progression in this field defects and in the disc appearance, that means it's a case of normal tension glaucoma. If there is no changes in the fields or else in the disc appearance in 6 months time, that means these are pseudotension glaucomas. And there are some conditions like ocular hypertension. Ocular hypertension is a condition where the eye pressure is above the normal range, but there are hardly any field defects or the disc changes. Now, this is running in families, and usually the females of 40s, infertile ages, and fair complexion people are the usual candidates for this particular glaucomas. Now, glaucomas, there are several ways we can treat these patients. In chronic simple glaucomas, also we can treat them by doing some surgeries. Surgeries means there are so many surgeries are there. Trabeculectomy surgeries, trabeculotomy surgeries, and sometimes use of some 5-fluorouracil, MMC, and all that also. According to the case selections and indications, we do that. And there are some medical treatments also there for these glaucomas. And medical treatment, of course, there are certain drugs, group of drugs are there. Beta blockers are there. Beta blockers means typical examples are timolol, atenolol, metoprolol, catalol, levonorol, and betaxolol. Betaxolol is actually a selective drug and neuroprotective effect also there. And other groups are these beta blockers functions as decrease in production of the aqueous. So usually the glaucoma is taking place when there's a mismatch between the production and the drainage. So when the drainage is also hampered, or when there's a overproduction of aqueous, then the eye pressure tend to go up. So other group of drugs are carbonic anhydrous inhibitors. Carbonic anhydrous inhibitors mean acetazolamide, Diamox. It comes as 2-septoazole. These drugs also decreasing the production of the aqueous, so that the IOP tend to come down with the usage of these drugs. Then the pilocarpine. There are certain type of pilocarpine drops we can use it. That one actually increases the conventional outflow of the aqueous, by which it reduces the eye pressure, to bring the eye pressure down. Then certain drugs like synthetic prostaglandins, that is Xalatan. Xalatan, it comes in 0.005%, or Travatan percentage is 0.004%. These drugs are actually increases the uveal scleral outflow, that is the drainage through the iris phase or the supracaudal space, and also certain amount of conventional outflow enhancement also there. And certain drugs, other groups of drugs are alpha 2 agonist drugs. The alpha 2 agonist drugs are like alpagan and all these drugs. Those drugs will increase the uveal scleral outflow. Uveal scleral outflow means through the drainages through the iris phase or the supracaudal space. So these are the common drugs and the interference for the glaucoma. So now there are certain conditions like secondary glaucomas. Secondary glaucomas mean secondary, say when there's a cataract there and cataract is not removed for a longer time, because of that one the lens, the human lens will swell. So that can give secondary angle glaucoma like features. Likewise, long-standing cataracts which is not removed from the eye can cause phacotoxic glaucomas. Those conditions will give a secondary glaucoma like secondary open-angle glaucoma like conditions. Now there are some conditions mimic like glaucoma, say some congenital optic disc anomalies, colobomas are the conditions where it looks like the glaucoma but it's not so. And to diagnose glaucoma there are criteria are there. One is the fields. So usually visual fields are Humphreys perimetric static analyzer field. We have to do that and we can assess the defects on the field. And directly we can use the plus 90D or 78D slit lamp assessment of a patient and assess the cup disc ratio of the patient. And also other parameter is the measurement of the intraocular pressure. So out of these three parameters, that is a visual field defect done by the Humphrey static perimetric analyzer or any other perimetric analyzer also we can use it, or else the CD cup disc ratio assessment by the surgeon on the patient by using the slit lamp, or measuring the intraocular pressure by using the tonometer or toronopino, whatever it is. Out of these three, we had to have two parameters to diagnose glaucoma.